Welcome back to Muff, Minutes Until Fit. This is your host, Imani. Our mission here on this channel is to bring awareness and give motivation, encouragement, and inspire our viewers in the best possible way. We aim to bring comfort to your mind, body, and soul. We discuss areas of importance of many ailments that many of you are suffering with or just want more information on. However, the information contained in this video is of general nature and does not constitute medical advice. Talk to your doctor for your individual circumstances. This week we'll discuss autism spectrum disorder, video part 2. Don't forget to hit the like button and subscribe to my channel at the end of the video. This week we'll be talking about the causes, risk factors, and how to get diagnosed. Causes. The cause of autism is unknown, but there are many risk factors. Vaccines do not cause autism, and neither does poor parenting. Due to the complexity of the disorder and the fact symptoms and severity vary, there are probably many causes. Both genetic and environment may play a role. Number of genes associated with the disorder, differences of development of several regions of the brain, disruptions in normal brain growth, defects in genes that control brain development and regulate how brain cells communicate with each other. Risk factors. Your child's sex. Males are more at risk than girls. Family history. Having one child with it increases the chances of another child having the disorder. Other disorders like Fragile X syndrome, which is inherited disorder that causes intellectual problems. Tuberous sclerosis is a benign tumor developed in the brain and in other vital organs. REA syndrome, almost exclusively in girls, which causes slowing of the head growth, intellectual disability, and loss of purposeful hand use. Extreme preterm babies. Babies born before 26 weeks of gestation has an increased risk. Parents' ages. Connection between children born to older parents and the disorder. Genes. Taking certain medications during pregnancy, viral infection, air pollutants, complications during pregnancy. Researchers are exploring whether these things play a role in triggering autism or not. Some evidence that the critical period for developing autism occurs before, during, or immediately after birth. People with autism has an increased risk of having epilepsy. Your DNA mutations may increase your risk. Diagnoses. A parent, caregiver, or teacher may very well be the first person to notice signs of autism in a child. It's never too early or too late for screening and evaluation. Diagnosing autism can be difficult since there's no medical test like blood work to diagnose the disorder. Doctors look at the child's behavior and development to make a diagnosis. Autism can sometimes be detected at 18 months or younger. By age 2, the diagnosis by experienced professionals can be considered very reliable. Testing for autism involves interviews, observation, evaluations by a psychologist, developmental pediatrician, or pediatric neurologist. Screening may include IQ tests, speech evaluations, occupational therapy evaluations, hearing tests, autism-specific questionnaires, and more. Functional levels. 1 is high functioning, 2 is moderately severe functioning, and 3 is severe functioning. If you are concerned, you can ask to be sent to a specialist for more in-depth evaluation. Developmental pediatrician. They are doctors with special training in child development and children with special needs. child neurologists, doctors who work on the brain, spine, and nerves, child psychologists and psychiatrists, doctors who know about the human mind. Developmental monitoring. Developmental monitoring observes how your child grows and changes over time, and whether your child meets the typical developmental milestones in playing, learning, speaking, behaving, and moving. Family, childhood providers, and other caregivers can participate in developmental monitoring. A checklist is used to see how your child is developing. Developmental screening takes a closer look at how your child is developing. The child will get a brief test, or you will complete a questionnaire about your child. The tools used for developmental and behavior screening are formal questionnaires or checklists based on research that asks questions about a child's development, including language, movement, thinking, behavior, and emotions. Developmental screening can be done by a doctor or nurse or other professionals in healthcare, community, or school settings. Developmental screening is a regular part of some of the well child visits for all children, even if there's not a known concern. Well child visits are at ages 9 months, 18 months, and 30 months. The American Academy of Pediatrics recommends that all children be screened specifically for autism at ages 18 months and 24 months. Comprehensive developmental evaluation. A testing tool that indicates if a child is on the right developmental track or if a specialist should take a closer look. If the screening tool identifies an area of concern, a more in-depth look at a child's development by a trained therapist or other specialists will look or observe. The specialist may observe the child, give the child a structured test, ask parents or caregivers questions, or ask them to fill out questionnaires. Formal evaluation determines whether a child needs special treatments or early intervention services or both. When to see a doctor. If the baby does not respond with a smile or happy expression by 6 months. If the baby doesn't mimic sounds or facial expressions by 9 months. If the baby doesn't babble or coo by 12 months. If the baby doesn't gesture, point, or wave by 14 months. If the baby doesn't say single words by 16 months. If the baby doesn't play make-believe or pretend by 18 months. If the baby doesn't say 2-word phrases by 24 months. If the baby loses language skills or social skills at any age. That does it for the covering of causes, risk factors, and when to see a doctor. Thank you for tuning in once again. This has been your host, Imani. Please feel free to comment or email to suggest any topic that you would like more information on. I will be glad to help out. Don't forget to hit the like and subscribe button at the end of the video. Until next time, be blessed.